Your tongue isn't just for tasting those delicious flavors or engaging in conversation. It's more than just a muscle that helps you enjoy your favorite foods and express yourself. It's also a health detective, working silently in the background. Your tongue is constantly offering subtle clues about your body's overall well-being, acting as an internal monitor. For centuries, doctors across various cultures have routinely checked tongues during examinations. They did this to look for early signs of underlying health issues, understanding that the tongue can be a window into the body. And even with all our modern technology, checking your tongue is still a smart and simple habit to incorporate into your daily routine today. The tongue surface is incredibly dynamic, changing quickly in response to internal and external factors. So, shifts in its color or texture, even slight ones, can reveal everything from simple vitamin deficiencies to the more complex effects of stress on your body. Taking a quick look in the mirror each morning, perhaps while you're brushing your teeth, can be a surprisingly effective way to spot subtle changes before you even start to feel sick or experience noticeable symptoms. You absolutely don't need to be a trained medical professional. Just take the time to notice what's normal and healthy looking for your tongue specifically. Then, simply watch for anything new, any deviations from that baseline. Think of checking your tongue as a free, quick, and easy daily health check-in that requires no special equipment. By paying close attention to this often overlooked part of your body, you're taking a proactive and active role in managing and understanding your own health and well-being. So, what exactly does a healthy tongue look like? It's a question worth asking, as the tongue can be a surprisingly good indicator of your overall health. Think of it as a window into your body. Ideally, it should be a consistent pink color across the entire surface, a vibrant, healthy pink, and it should be free of any dramatic or sudden color changes. We're talking about significant shifts, not just slight variations. The surface is naturally slightly rough. This texture comes from the presence of tiny bumps. Those are your taste buds, and they should not appear swollen or irritated. Redness or inflammation around these bumps could be a sign of something amiss. A thin, almost translucent, easy-to-brush away white coating is perfectly normal, but it definitely shouldn't be thick, clumpy, or difficult to remove. That could indicate an overgrowth of bacteria or yeast. Your tongue should feel moist to the touch, indicating adequate saliva production, not dry or cracked. Hydration really matters for overall tongue health. Be sure to watch out for any deep cracks or fissures, persistent sores that don't heal within a couple of weeks, or any unusual lumps or bumps that weren't there before. These are definitely not normal findings and warrant a checkup with your doctor or dentist. In short, a healthy tongue is generally pink, slightly bumpy, thinly coated, and consistently moist, and, most importantly, pain-free. This is your healthy baseline to aim for. Use this as your daily comparison. A quick check in the mirror each morning can help you spot any changes early on. Changes in your tongue can signal health issues. Pale tongues may mean low iron or B12. Bright red could signal vitamin deficiencies or illness. Yellowish tongues often point to bacteria or rarely liver issues. Thick white coatings may mean thrush. White patches that won't scrape off need a doctor's look. Smooth, glossy tongues can mean nutrient shortages. Map-like patterns are usually harmless. Persistent sores or lumps, especially those lasting over 2 weeks, should always be checked by a professional. If tongue changes last more than 2 weeks, despite your best efforts to maintain good oral hygiene, or come with pain that doesn't subside, a persistent fever, or any trouble eating or swallowing, it's time to see a doctor for a professional evaluation. Don't delay seeking medical advice in these situations. Don't ignore persistent lumps, sores that don't heal, or dramatic color changes that appear suddenly and without an obvious cause. These warrant a closer look. Remember, your tongue is just one clue in the larger puzzle of your overall health. So don't panic over every minor change or fleeting discoloration. Context is key. Some odd colors or textures are perfectly harmless and fall within the range of normal variation. Many temporary changes are simply caused by the food you eat or the medications you take. Certain foods and drinks can temporarily alter the color of your tongue. A professional can help connect the dots, consider all the factors, and give you peace of mind by providing an accurate diagnosis and appropriate guidance. Make gentle tongue checks a regular part of your daily oral hygiene routine. It's a simple act of self-care that can empower you to take charge of your well-being. Your tongue has a story to tell about your health. Listening to it and paying attention to any changes helps you stay healthy, informed, and ready to embrace life to the fullest.